Hello, my name is Jamie Goebel, and thank you for having me here today. What is multiple sclerosis, or MS? The National Multiple Sclerosis Society describes MS as an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. According to the National Multiple Sclerosis Society, more than 2.3 million people are affected by MS worldwide, and this number can only be estimated as new cases are not required to be reported to the Centers for Disease Control and Prevention, or the CDC. People with multiple sclerosis should exercise because the positive effects of exercise outweigh the risks, and appropriate planning should be used for exercise to prevent exacerbation of symptoms. So in this presentation, I will discuss the positive effects or the benefits of exercise, how they outweigh the risks, and how these individuals can use appropriate exercise planning to prevent exacerbation, or in other words, flare-ups of symptoms. There are many positive effects of exercise in this population. Physiological or physical benefits include better cardiovascular functioning, improved strength and balance and endurance, better bladder and bowel functioning, and less fatigue, according to the National Multiple Sclerosis Society. They also report cognitive and emotional benefits from less depression and improved attitude. Exercise also brings about opportunities for social interaction through participation and interaction during social activities. There are also some exciting new studies exploring the role of exercise in brain repair and health, according to Smith 2012. Individuals with MS take certain risks when participating in an exercise regimen, including fatigue and overheating. The Cleveland Clinic Foundation reveals that some people with MS experience heat sensitivity, and their symptoms temporarily worsen with their body temperature elevating, and the symptoms subside as their body temperature returns to normal. These individuals know their limits and should not overexert themselves while exercising. When they begin to feel the burn, as they say, they need to immediately stop and cool down as to avoid exacerbating their symptoms. I have prepared a visual aid, which you can see here, which indicates the intricate balance between the benefits and the risks of exercise in people with MS, as described by the Cleveland Clinic Foundation and the National Multiple Sclerosis Society, in this diagram, which I have illustrated and created. My visual aid demonstrates the fine line, which is demonstrated by this horizontal bar, of the fact that people need to, the fine line which people must maneuver when choosing an appropriate exercise regimen for themselves. Because of the level of the consequences involved, people with MS should always consult their physician prior to engaging in a new exercise regimen. Ancillary services such as physical therapists experienced with MS would also be helpful in developing and managing a beneficial exercise program, as demonstrated by the National Multiple Sclerosis Society in 2014. Now I will explain how people with MS may incorporate appropriate planning into their exercise regimen. According to the National Multiple Sclerosis Society, any person with MS should again consult their physician before starting a new exercise regimen. Other guidelines for planning exercise also provided by the Cleveland Clinic Foundation, such as avoiding the hottest hours of the day, such as between 10 a.m. and 2 p.m., performing warm-up and cool-down exercises, and gradually increasing their workout times. A safe environment would be gained through avoiding slippery floors, rugs, and poor lighting. Individuals should use rail or grab bars when needed for balance, and if they are sick, fatigued, or in pain, they should immediately stop. Exercise activities suggested by the Cleveland Clinic Foundation include water aerobics, swimming, tai chi, and yoga, as they work well for people with MS. Based upon this knowledge, people with MS should exercise to help alleviate and manage symptoms by using appropriate planning to prevent exacerbation of symptoms. The benefits of exercise do outweigh the risks, and symptom management can be maintained during exercise with appropriate planning. People with MS have an opportunity to increase their quality of life by safely incorporating exercise into their lives. They also truly gain a new friend and excellent support system with exercise. Does anyone have any questions?
What type of exercise is recommended for people with MS?
That's a good question. Exercise programs should be individually designed and based upon the person's neurological symptoms and needs. However, resistance exercises such as aquatics have been well tolerated by people with MS and promoted by the National Multiple Sclerosis Society. In a study performed by Salem et al., this form of exercise has many benefits such as improvement in strength, cardiovascular endurance, fatigue, quality of life, and psychosocial well-being.
What types of cognitive benefits are seen with exercise in people with MS?
Actually, the effects of exercise on cognitive function in people with MS continue to be studied today. In a study by Bryken et al., they report significant improvements in learning, memory, and attention in people with MS participating in higher intensity exercising. This study also suggests that with exercise comes less central nervous system damage, and better brain functioning. According to the Multiple Sclerosis News Today, a study by the University of Illinois and the State of New York at Buffalo also found benefits of exercise in mental processes of people with MS. These studies will be starting points for additional research in this area.